Okay, good morning, everyone. Welcome and thank you so much for joining us. I'm Claire Morrison. I'm Director of Engagement and Change at Healthcare Improvement Scotland. I'm absolutely delighted to see so many people from across Scotland here today, and great to see even more people coming in every minute. Today's launch very much builds on the previous work we've undertaken in improving our response to people with co-occurring mental health and substance use conditions. We know this is a really challenging time for everyone in the health and care system. So the demands on services, the expectations of those receiving services, the financial and workforce pressures that you all face every single day. We know that all of this can make it difficult to find the time and the space to look at improvement and redesign. And we completely understand this, and we want you to know that we're here to support you and to work alongside you. Healthcare Improvement Scotland is the national improvement agency for health and care, and we have prioritised work in mental health and substance use because we recognise the challenges that people face, both those people seeking support from mental health or drug and alcohol services, and also the people working in these services. We're developing programmes in mental health that focus on standards and assurance and reform, alongside programmes focusing on choice and quality of drug and alcohol services. And a core component of the work is engagement and co-design with the people who know these systems the best. And that, of course, is the people with lived experience of poor mental health and of substance use, and the experience of people who work in these services. At Healthcare Improvement Scotland, we do have legislative duties to assure that there is public involvement when service changes are being decided. But really importantly, it's not just about legislation. We see the benefit of meaningful engagement right across our work programmes. We know it's the people who have the experience of using services who can understand how to improve them and what the impact of changes, whether they're small or large changes, will be. So today we're here to launch the National Mental Health and Substance Use Protocol. Our speakers will outline how it's been developed and how you can use it as a supportive resource. And we hope that in the months ahead, we can work with you nationally and locally to develop and embed best practice in Scotland. It is really important to recognise the good work that has happened already for people with co-occurring conditions. We need to build on that, on the excellent services that are already out there, including those within the third sector and people's communities. Many gains can be made from having services work better together, for staff to feel confident that they're providing the right advice and the right treatment, and for people to feel their needs are being met. We know that different areas across the country will be at different stages of this journey. Some of you already have interface guidance setting out how your services should work together. Others are adopting integrated referral hub models, enabling multiple disciplines to collectively identify the most appropriate places for people to receive care. And others are investing in roles to support services to understand their roles and responsibilities in relation to co-occurring conditions. All of these things are enabling better collaboration across the system and ensuring people get the right care at the right time. Similarly, the protocol identifies a range of ways that the system can create the conditions for joined up thinking to maximise the impact the health and care system can have on the ability of people affected by co-occurring conditions to live meaningful lives. All of you here today can play a pivotal role in your organisations to develop or refine your local protocols to adapt to the national guidance, or in advocating to improve outcomes and experiences for people with co-occurring conditions. And we really hope that following today's event, you'll be an active participant in the learning system we'll be delivering, to share your work with others, and for us all to support each other in identifying and spreading what works. People want to receive integrated care that addresses their needs, and we look forward to supporting you on your journey to consistently deliver that using all of the assets that within your community. So before I hand over to Robbie, I'm going to just run through our agenda for the day, hopefully on the next slide. So after the opening remarks that we've just been through just now, we will move on to the ministerial welcome, and we're delighted to have a welcome video from Marie Todd, who's the Minister for Social Care, Mental Health, Mental Wellbeing and Sport. We're then going to move into the detail of the protocol. So first of all, how the protocol was developed with Dr. Shampreet Blaney, and then what the protocol looks like and how to use it with Benjamin McElwee. We'll then have some time for questions and answers. So I'm delighted now to hand over to Robbie Pearson, who is our Chief Executive here at Healthcare Improvement Scotland.
Thank you very much, Claire, and good morning, everyone. Absolutely delighted to be here and have the opportunity to share in this moment in terms of actually launching the protocol. And I think one of the things I'd like to do first off is to really recognise the context in which we are working here and the challenges we face. Obviously, we've seen a significant increase in alcohol and drug-related deaths. We've also seen a worrying increase in relation to suicides as well. And the other thing that I think is important in this is about the link between mental health and substance misuse, and up to 56% of suicides in a 10-year period between 2008 and 2018, substance misuse was a factor in that up to 56% of cases. And we also know that around 2/3 of adults starting treatment for substance misuse have had some sort of mental health treatment need requiring to be addressed. So it is a significant issue, and that makes it all the more important for myself as Chief Executive of Healthcare Improvement Scotland to be here today and really endorsing the work of this. It is absolutely central to our mission as an organisation, and I think it's absolutely critical that we put collaboration at the heart of it. And the point that Claire made earlier is crucial in that regard. We can only achieve this by working together and working here in partnership, and therefore all the more delighted by the turnout and the contributions that we make. Now, in terms of the stakeholders, I was absolutely delighted recently to meet with a number of the chairs of the alcohol and drug partnerships in Glasgow, and they acknowledged the work, they acknowledged the successes, but they also recognised the challenges and they are facing day in, day out. And so it's crucial in taking this forward. We are doing in partnership with our boards, with health and social care partnerships, with local government, and the alcohol and drug partnerships are crucial in all of this as well. The protocol, and I know Shampreet will say a bit more about this in due course, is in an area of challenge, an area of complexity. This is not a straightforward thing that we're addressing here, but ultimately it's going to be doing something important in terms of people's life chances, their opportunities to for work, their opportunities in respect of housing are all crucial in this in terms of how this comes together, and alongside the medication-assisted treatment standards and our residential rehabilitation pathways. So this is complex, it's challenging, it needs to be integrated, as Claire referenced earlier as well. So there's some other things I'd like to also touch on in the context of Healthcare Improvement Scotland. And one of the things I would say over the life of the organisation is that we have invested a lot more time and effort and energy into mental health as a priority area. And you take the work on reform in relation to tackling inequalities and those who have had negative experiences of services and frankly met prejudice in their lives. I think we've got a critical role here to do to tackle it. We've also got our work on standards, and we're supporting the core mental health standards and secondary mental health care in Scotland as well. And alongside that, we have the Scottish Patient Safety Programme for mental health, as well as a critical component of our contribution to driving a safer health and social care system. The other thing I'm keen to emphasise that this is not in isolation. So we are doing other work in relation to assurance, work on excellence in care as well, and we'll be taking forward further inspections within the mental health services in conjunction with collaboration with the Mental Welfare Commission as well as the Care Inspectorate. Claire referenced, and I know people talk about this over the course of the morning, is about, at the end of the day, we're here to protect and enhance and support the well-being of the people of Scotland. And for those with mental health and substance misuse problems, then it is critical that we work together to transform services and not do it in a compartmentalised fashion. and also about the experience of individuals and the team working alongside individuals who have experienced care, and the importance of the protocol is ultimately being designed with people at the centre of it. In terms of that complexity, though, I really do want to emphasise that from today, we cannot do this as a single organisation. Healthcare Improvement Scotland will not achieve this alone, and we must take responsibility right across the system, working together. And I know there's been a lot of work at a service level in terms of making sure our response is person-centred, enabling choice and control, and also through the work of the MAT standard as well. So the protocol is a critical step, is important in how we adapt and ensure a much more integrated response, and thinking about how those services come together in a compassionate way, in a way in which acknowledges the different factors in which impact on people's experiences and outcomes. And I know Shampoo will say a little bit more about that, some case studies of how individuals go through the system and how they connect, whether it's with the health and social care system or indeed with the justice system, housing and so on. All important components, and we need to think in a much more collaborative fashion. So, really in conclusion, I really wish you to engage with the protocol. It's a resource, is intended to support people to deliver the outcomes we are seeking, to celebrate the importance of sustaining person-centred care in the work that you do, but how this protocol will help you to make a difference as well, and where improvements can be made. So over the course of the morning, sadly I can't stay for much longer in the morning today. I've got a board meeting, but please be curious, ask questions, share what you're proud of, share what matters to you, and engage with the team and right across the organisation in supporting you in this endeavour. So a big step forward today, and I'm really grateful for everybody involved in getting to this point, and look forward to hearing more in due course. So thank you very much, and can I hand back to you, Claire? Thank you.
You certainly can. Thank you ever so much, and thank you particularly for your support and focus on this really important area of our work as an organisation. So next, we're delighted to share with you a welcome from Marie Todd, MSP, who's the Minister for Social Care, Mental Wellbeing and Sport. Unfortunately, she couldn't join us in person today, but she has recorded a message to share with you all, which we'll play now. Thank you.
Hello, and thank you all for coming along today. I'm sorry I can't attend the session, although I really look forward to hearing more as you begin using the protocol in your areas. I'd like to begin by thanking all of you for your tireless efforts across mental health and substance use services in providing support, care and treatment for people, along with their families and carers. Today is an opportunity to celebrate and reflect on the significant work that's been achieved through innovative practice, and to look towards the future of services supporting people with co-occurring mental health and substance use conditions. We're now in the third year of our national mission. This is a time to strengthen our efforts to ensure our work is making a real difference to people on the ground. I'm sure many of you will have seen recent figures showing an increase in drug-related deaths in 2022, as well as an increase in alcohol-specific deaths in 2023. These increases underline just how deep-seated the challenge is. It's clear that even greater change is needed to improve outcomes for people that use substances and their families across Scotland. I recognise now more than ever the importance of getting care and support right for people who access substance use and mental health services. I believe the protocol will have a positive impact for both those working in and those accessing services. Considerable progress has been made to develop the protocol in recent years. This work builds on the learning and experiences from the Pathfinder sites, bringing the best practice from across the country and internationally. The Mental Welfare Commission's Ending the Exclusion Report and the Rapid Review into Mental Health and Substance Use Services. Collaboration and co-design have been key in developing the protocol. I'm delighted that it's been developed not simply for, but with services. This includes input from a stakeholder reference group with members across statutory and third sector services. Crucially, it's also been informed by the active participation of people with lived and living experience. The Scottish Government's committed to ensuring that we work across policies and portfolios to better understand common issues and how to resolve them. We need better working links between services and to drive an inclusive culture that puts the needs of people at the heart of everything that we do. As I'm sure you're aware, the Scottish Government is supporting full implementation of the 10 medication-assisted treatment standards by April 25. The MAT standards recognise that each person requires holistic care from a number of services. That's why we included a MAT standard dedicated to mental health. MAT Standard 9 states that all people with co-occurring drug use and mental health difficulties can receive mental health care at the point of MAT delivery. This standard sets requirements for both mental health and substance use services. By implementing the protocol, local areas will also be implementing MAT 9, ensuring that all people with co-occurring conditions get timely access to the care and support they need. However, the protocol is not limited to opioids or medication-assisted treatment. Local areas can adapt the exemplar protocol to meet their own circumstances and implement fully. The actions we take to support people with substance use and mental health needs must look at the whole person and their wider circumstances. These include housing, relationships, physical health or employment, and not just their mental health. The protocol has been designed to complement the work of other initiatives so that people with co-occurring mental health and substance use issues receive high-quality, person-centred care. These initiatives include the national rollout of the Distress Brief Intervention Programme, piloting of a self-assessment tool to support implementation of our new mental health standards, and the National Trauma Transformation Programme. Today's event marks the next stage of the great work and collaboration which is already underway. We are keen to maintain the momentum gathered and work with you and Healthcare Improvement Scotland in successfully implementing the protocol more widely. Thank you for listening, and I hope you enjoy today's session.
I'd like to move on now and introduce Dr. Shampreet Blaney, who's our clinical lead here at Healthcare Improvement Scotland and a consultant psychiatrist at NHS Greater Glasgow and Clyde, and she is going to talk with us about how the protocol was developed.
Thanks very much, Claire, and it's delight. I'm really delighted to see so many people here today, and really the way that Claire and Robbie and Mary-Todd have set the scene, just talking a bit about the momentum that's been building behind this for many, many years now. And it's more recently, again, with the MAT standards, the Ending the Exclusion report from the Mental Welfare Commission, and as well the Rapid Review, the Way Ahead report, which again outlines the need for local interface protocols. It doesn't just span that, though. It spans much wider issues, socioeconomic challenges, looking at suicide prevention and support for people with complex trauma as well. I myself have worked with the Healthcare Improvement Mental Health and Substance Use Programme since 2022, and I've learned a phenomenal amount. And I'm going to talk a little bit about my experiences and how much I've learned, and how that has also led to ongoing development of the protocol. Next slide, please. So a wise person once said to me, sometimes it takes many people working long and hard on something from different angles with different energies and skills to finally get that meaningful change. And I often fall back on this quote to just remind myself to keep working with the teams around me to continue good work, especially in the face of many different challenges, that hit us on a day-to-day basis. I mean, the pandemic itself was one of the biggest black swans that hit us a few years ago. And how do we keep working to help individuals who seek care, who have difficulties with mental health and substance use, amongst all the wider difficulties that we all face on a day-to-day basis in health and social care? I'm going to talk a little bit about some patients that I've worked with in my clinical role, who have had lots and lots of positive experiences, having come through adversity. There is so much positive work that goes on, which isn't always visible to all of us. And I had one patient who was only 19 years old, transferred over from Child and Adolescent Services. She had a neurodevelopmental disorder. She had butane gas addiction as well, so different from opiate use or benzodiazepine use. It was quite a unique case. She ended up on the acute psychiatric ward and had lots of difficulties with sensory stimulation and violent behaviours, actually, and significant memory problems related actually to the butane gas use. It took a while for her to stabilise on the ward. She had notable cravings for butane gas. We had InReach from third sector services that came in to start relapse prevention with her on the ward, and this helped immensely. We were able to transition her back to the community. She stabilised, she did well with actual minimal medication, actually, but with more supports around her, interventions from social work to help optimise her housing, peer support and befrienders, and immense hard work from her third sector worker to keep her stable, and she is now at college. And that is certainly one example that sticks with me. She had input from lots of different services, community mental health, InReach from third sector, substance misuse services, and just seeing that positive change in this one individual patient with complex needs was incredibly rewarding. I have seen another colleague, a community psychiatric nurse in the community mental health team, work very hard with a patient who had intermittent psychotic episodes related to heavy cannabis and cocaine use. And the CPN worked tirelessly to ensure this patient was seen, reviewed regularly, looking out for any signs of relapse to psychosis, worked with reducing cocaine and cannabis intake. Again, the CPN engaged and worked really well with the third sector worker that supported this patient very hard. This patient was seen by myself medically and had some antipsychotic medication. When he did become unwell with psychotic episodes, crisis team were involved. When he did become more acutely unwell as well, and at times he did end up on the ward when he was more acutely unwell. These were all examples of actually really positive communication going on between team members, trying to keep the patient at the core of what was going on and trying to keep him safe and well. When I worked in addiction services, I had a patient with a history of alcohol dependence, and had successfully sustained abstinence from alcohol with support from addiction services for a number of years. Unfortunately, he then went on to procure illicit benzodiazepines from the internet, from the dark web, which is, again, these complex issues, new trends, new changes that we're seeing in society, that we are all trying to grapple with to help the actual individual stuck in the middle of this. This patient became really quite unwell, was heavily addicted to these internet procured benzodiazepines, came into addiction services and stabilised. There was a history of complex trauma, and once stabilised, he was then able to access the addiction psychology service for ongoing treatment for that. Again, lots of multidisciplinary meetings, lots of communication, all this positive work that does happen, but every day, how do we see that? How do we celebrate that? It's hard for people to know exactly what's going on in a positive sense at times. We, of course, know that there are areas that require improvement when it comes to communication, easing transitions, allowing individuals to break through sometimes more tricky interfaces where they can't always access the care that they need. So I wanted to thank you for listening, and I hope those kind of examples might resonate with yourselves in your own areas of work and individuals that you have worked with as well. Next slide, please. Going on to how the protocol was developed. I worked with the Mental Health and Substance Use Programme prior to the protocol being announced by Angela Constance in March 2023. There was so much learning that the team had already garnered at this point. So when the protocol was commissioned, there was already lots of learning to build on and lots of momentum building behind that. And that was really encouraging for me working with the team as well. We continued to then build on the stakeholder engagement we had already done, learn more. We set up reference groups and launched the programme in March 2024. We've continued to develop the protocol, hone it based on feedback, based on other wider challenges that continue to hit us all at different times. We've engaged with senior responsible officers, many of whom are here today as well, and done workshops with them. And that takes us to today, where we have come to our launch. Next slide, please. I wanted to talk a little bit about the infrastructure of expectations, which can at times feel overwhelming for all of us. This goes on all the time, every day. There's lots of hard work going on everywhere. Up at the Scottish Government Healthcare Improvement Scotland level, we have worked very hard engaging people with lived and living experience, hearing their feedback, trying to understand where things go well and where things would really benefit for a focus for improvement. And amongst all that, financial challenges, we have your council, the Health and Care Social Partnerships, your IGBs and NHS health boards, which help commission your service delivery. And amongst all that, we have our day-to-day staff on the front line, both in statutory services, social work services, housing, third care sector providers as well, primary care, acute care services. And amongst that, different expectations from professional regulators, advisory groups, royal colleges. So there's always so much going on all the time. And it can feel overwhelming at times. So it is about honing down, actually, what do we need to do in our sphere of work? What is this protocol going to help us to achieve for those individuals with co-occurring mental health and substance use difficulties? And I think it was Mary Todd again touched again, the MAT9 standard itself specifically focuses on this. And certainly I think the MAT9 standard was a very welcome addition to try and focus that on this very unique group of individuals who have very complex needs. Next slide, please. A lot of the extensive engagement we've done with individuals with lived and living experience has involved mapping their journeys and the immense amount of learning, how they have experienced accessing services, both for mental health difficulties and substance use, how their own difficulties have been assessed, communicated to others, how they have accessed services of different levels and different intendencies, and their interfaces with staff as well. And we've also engaged with family members and groups that represent family members as well. Next slide, please. Amongst one of the core pieces of work really that the programme has worked on is mapping systems of care, which in the wider infrastructure, which I showed in a previous slide, can feel very, very big and huge and difficult to navigate. So sometimes there's immense value in actually just seeing it and mapping it and writing it down. I can't take credit for this Miro board. It was developed by the team, but just seeing the journey that a patient will take, right from self-referral or referral in if they are more acutely unwell, and how they then go through the NHS different departments and all those touch points, at which points interfaces in between different departments are actually key to help these individuals. It can be incredibly helpful and powerful just to actually see that. And these mapping out these systems of care was done with extensive engagement with staff, service managers, frontline staff who actually work day to day in our services that span the community, inpatient care, acute services, primary care, and your non-statutory care services as well. Next slide, please. So that's me come to the end of my part, and I'd like to hand over to Benjamin Malcolm for the next part, who will talk about next steps, a little bit more about the protocol, and how do we take this forward, all working together in a really positive way and continue that momentum. So thank you.
Next slide, please. And you can just go on to the next slide as well. Thanks. So yeah, I'm delighted to be here as well. I think this is a really important milestone, and I thought it'd be useful to start to acknowledge, just as the other speakers have, how difficult this area is. You know, it's a real area of complexity for people. I'd like to acknowledge how challenging co-occurring conditions are to manage, both for individuals to cope with as their needs fluctuate and interact. They don't necessarily know where their needs would be best met, and there's a role for services there in helping them to understand what good care would look like for those individuals. But it's also difficult for services within the current context to be able to prioritize the work that would enable them to work better together. So given the pressures that they're under, and I thought it was useful just to mention that, you know, this is an area that has been a focus for a long time. It was over 15 years ago that the Scottish Government published Closing the Gaps, with the aim of supporting joined up local delivery for people with co-occurring conditions. And yet it's still an area that requires attention. You can see in that quote there that by the end of 2007, they hope to support joined up local delivery and move the joint agenda forward. And yet it's still something that we're grappling with today. Next slide, please. And then this recent report from RADAR, Scotland's early warning drug system, which looks to identify potential risks of harm in drug trends, identified that risks are increased for individuals as presentations include polysubstance use, and that individuals may experience stigma from services and from their communities. And it recommends, therefore, that service delivery and prevention adapts to these changing drug trends. Champreet went into what some of those changing circumstances are, and I think it's something that services need to be kind of malleable for. We know that many services are set up to deal really well with opiate-based dependency, and then maybe less well with some of the other more emerging drug trends. And therefore, as the Minister mentioned, the protocol, which we'll explore shortly, has been designed in a way so that it itself is malleable. It's not necessarily prescriptive. It can be applied to local context, and the guidance that it includes can be adapted as circumstances change to maximise the resources that are available within local systems and to respond to the changing conditions and contexts that those systems are experiencing. Next slide, please. And again, just as our speakers have noted, the whole health and care system is under pressure, but arguably, particularly mental health and alcohol and drug services, given recent budgets and service demands. And therefore, that can be a really challenging context in which to think about how to work better together, to think about what collaborative working would look like, to think about what system improvements could be made or what redesign could be made when it may feel like you're just firefighting, you're trying to ensure that people are safe and well, and it's therefore difficult to prioritise some of the work that might need to take place to help services to deliver better care. Next slide, please. So this work stems from the previous work that we've done that Champreet mentioned. We worked with 6 Pathfinder sites across Scotland in the previous iteration of this programme, and then this iteration of the programme, or this next phase of the programme, has a particular focus on addressing recommendation 1 of the Way Ahead Rapid Review. And that recommendation is that for each area across Scotland, there's an agreed protocol setting out how mental health and substance use services should work together, and that that's monitored so that the impacts of that can be understood and felt. Next slide. And as you can see in this kind of high level program timeline, we're transitioning from phase 1, where we were in that discovery phase. We were building on all the learning that we had from the Pathfinder program. We were engaging with stakeholders. We were developing the protocol. Now, thankfully, we're launching the protocol and ready to support you to understand how that can work within your local areas, and also to learn from you to strengthen it, to make it better, to be able to understand what impact it's having, to be able to help you with some of that. And I guess so that you can also feed into the national learning system. You know, we want to work nationally to provide that support, to be able to gather examples of things that people are doing that are working well, to celebrate all that work that's happening across Scotland, and to facilitate a peer network so that those working on this area within their local systems have that peer support. It can be extremely challenging when the demands are so high upon services, so that you have a kind of network of people that you can rely on, that can give you advice, both as critical friends and supporters, and share what they're doing, and so that you can share what you're doing. Next slide, please. And then this is an overview of what's included within the national protocol. So the green petal, the one about joint decision making, working on transitions, this is really the part that most applies to local interface guidance or local interface documentation. And I'll go into an example of how to use that on the website before coming back to what's included in some of these other bits. Next slide, please. So on the landing page, there's a box for each of these sections that pulls out what it's trying to achieve, really, and some of the key aspects that will enable that. And then if you click on the find out more, it takes you into the fuller detail. And we've broken this down into pathway and access services, understand and respond to needs, roles and responsibilities, and communication and information sharing. And then if we click into the pathways and access to services bit, there's more detail again. So we've heard from people with lived experience how important this part of the process of getting to access care is. You know, they've described assessments as like sitting an exam, but for them it's one where they don't really know what the right answer is and whether their response will lead to them being able to access services or being denied services because, for instance, their substance use needs may be seen by services to preclude them getting the appropriate mental health support because maybe they're not able to do some of the deeper psychological therapy that they need, for instance. So within this, there's a recommendation of agreeing a shared understanding of levels of severity across services, looking at agreement across services and what assessment processes should look like and what they mean, streamlining some of those assessment and referral processes so that services are able to respond to people's needs in a trauma-informed way. So that might be reducing duplicate assessments, enabling conversations to take place between services. Next slide, please. And then if you go on to the find out more, you'll see examples of what this might look like. So some of the things that you could do within your local system. So, you know, agreeing those screening tools that you're going to use, trying to understand who within services can make referrals. You know, we've heard often about people within, both from staff and from people themselves, about assessments taking place within substance use services that then lead to another assessment taking place within a community mental health team, for instance. Yet staff have told us that they themselves are registered mental health nurses. They are capable of carrying out these assessments, and a kind of frustration that they feel that this leads to another step in the process when it could be streamlined. And then next slide, please. Finally, for this bit of the website demonstration. So over the next few months, as I said, we'll be working with you to pull together some of these examples and resources that might be useful for you for each of the sections of the protocol. So in this example, some of the resources that might be useful might be some of the screening tools that others are using, some of the interface guidance that exists within local areas, standard operating procedures that may be used within case allocation or case allocation meetings, and any other resources that might be useful. Next slide, please. As I mentioned, that last section was really around the operational interfaces, but that's just, I guess, one part of it. You know, there's a lot of work that would need to go on to ensure that staff are aware of local protocols or interface guidance, but also that they're able to use it. So within the Enabling Better Care section, it really looks at how the workforce can be supported to be able to effectively implement local protocols. So, for example, we've had calls with around 14 areas across Scotland. We've heard about the issues of staff recruitment and retention. The Public Health Scotland survey on drug and alcohol service staff outlined some of the burnout and low morale that staff are experiencing. So there's something about how can the workforce be better supported to understand who's who across services, so that they can build those connections, so that they can pick up the phone and get some support, whether that's formal or informal support from mental health services where they feel that needs are beyond the threshold that they feel adequately able or confident enough to deal with. Because in these calls, we also heard about staff who maybe felt a wee bit de-skilled or didn't have the confidence to use the skills. So, you know, they'd had mental health training, but it'd been a while since they used that mental health training. And therefore, for people with co-occurring conditions, they needed that bit of extra support. So there's something about how can they get that support from other services, but also how can they be trained within their local systems and supported beyond training, coaching and supervision, shadowing, mentoring, other things that can happen within local systems to ensure that staff have the connections, the skills, the confidence to be able to adequately manage co-occurring conditions. Next slide, please. Then in the quality management system section, there's a bit about how data should be used, some suggestions for how data should be used, so that the implementation of interface guidance can be overseen through appropriate governance routes, so that learning can take place, that there should be a curiosity about how experience and outcomes can be improved for people. And this includes asking people themselves about their experiences. You know, we've also heard from people and from services about how people accessing services don't necessarily feel that their needs are being met, but there's almost a tension there between the views of staff and the views of people, because quite often the interventions that they'll be receiving would be the same interventions, whether that was within a substance use service or a mental health service. So there's also something there about how do you ensure that you know that their needs are being met most appropriately. Next slide, please. And then the section on leadership and culture change has some guidance on what leaders and managers could do to enable improvement. For example, emphasizing that it's everyone's job, actively seeking to ensure services are non-stigmatizing and trauma-informed. We know how difficult it can be for people to seek help in the first place, either with a mental health condition or with a substance use condition, and therefore how difficult it can be to seek help if you have both of those. So it's about ensuring that those services are able to attend to people's needs in a way that doesn't make them feel worse, that doesn't make them feel stigmatized. Also about making connections across the wider system to ensure that substance use is considered, ensuring the third sector is visible and valued, and empowering staff to make changes. Next slide, please. And then again, in whole system planning and delivery, it suggests that there's connections being made with other work happening with local systems. So, you know, there's some of this protocol that you might want to prioritize first, but there's other things that it would be good to get a start on. There'll be things happening within local systems. There'll be reform work happening within the mental health system, for instance. There'll be constant change and redesign happening within primary care. So it's how does substance use get a voice within that so that it is considered and so that there is alignment with these priorities across the system. Also thinking about the other local priorities that are being worked on, the other standards. We heard about the core mental health standards, thinking about how substance use fits into that context as well. And having an acknowledgement of how changes might impact other areas of the health and care system or result in access barriers. Next slide, please. And then there's a bit about ethos and approach, so that there's some key principles are embedded within service delivery for people with co-occurring conditions. These are that co-occurring conditions are supported concurrently, that the system's responsive to changing needs, that services up to a point can provide in-house support for co-occurring conditions, and that there's pathways into communities and recovery-oriented systems of care, as well as a way back into statutory services where that's necessary. Next slide, please. So that was quite a brief overview of the protocol as it stands, and we'll be able to share the link with you so that you can go into the fuller detail. And we'd be really keen to work with you, as I said, to understand what you're already doing and to pull out some of those examples, because I feel like there's a lot of great work that's already happening. We've heard about some of the great work that is happening across Scotland that we want to spotlight so that others can learn from that and take inspiration from that. Next slide, please. And this is just a reminder of the program timeline. So again, we're in this test and implement phase. We're aware that this is the first iteration of the protocol. It won't be perfect. We need to see what it looks like on the ground. We need to see how areas are using it and what their learning is from that, and how they're using data to understand what difference it's making for people, for services, and for the wider system. I think that's it.
I'd just like to reiterate some of what we've said today. So next slide, please. Here is the link to the protocol itself. We would really welcome your comments, suggestions, thoughts as it's launched now. And we would welcome any conversation about it, about, you know, your thoughts about implementation locally. There's more comments and questions in the chat coming through there. So this is the link. Please share it, please use it, please go and have a look at it. We'd really, really like you to engage with this, and thank you all for being here today to hear about it. Next slide, please. Please, could you, if you have 1 minute, do a little bit of evaluation? We love to know what you think of being here. And yes, we can definitely share the link in the chat there. That's been done. Thank you, Ruth. And we'd love to know how this has helped and in what ways it might have been better. So if you can scan that and just give us a moment of your time, that would be great. And if you can't, feel free to put any comments in the chat. And next slide, please. So finally, I just wanted to reinforce some of the things that we've said today. So the first is that implementation is key. Thank you all for engaging today, and we hope that we will continue to engage with you over the coming months and years. We would like to be engaged with every part of Scotland, and you as some of the key people within that, it would be great to be able to join with you as you develop your local protocols. If you are doing or developing any protocol work, any innovative practice, or meeting any challenges, do please get in touch, because as well as implementation being key, connection is key in this work. We know, and we've seen, that we've got 20 years worth of not quite managing to meet the recommendations within national sort of guidance, and we would like to work with you to ensure that we can make local systems, services and outcomes for people, families and staff, meet the needs of those who are in attendance around mental health and substance use. So we'd really like you to stay in touch, and we would really like you to see this as the beginning of a journey with us. There is how you can keep in touch, and we can definitely share that in the chat as well. So thank you all, and I'll hand back over to our chair, Diana, just to finish off for today.
Thank you so much, everyone. And as Rachel said, the biggest thing I want to today is the words of Shampri, that this will take time and energy and enthusiasm of all of us to make this work. This isn't something that we are putting out there and expecting to miraculously happen. If this was easy, it would have happened by now. So please see yourself now as part of the delivery team of this protocol. This is something we are jointly doing, and we will bring whatever support from Healthcare Improvement Scotland will enable that alongside you, and where we can play our part. Helpfully, your feedback on how we can most helpfully use our role would be welcome feedback as well. I really want to thank the Minister for her presentation, and that will be sent out, as I said, but thank you so much. I'm delighted the Minister has given this work her support, as well as our Chief Exec and our Director. I'd also like to thank Shampri and Benj for their detailed presentation, and Rachel for fielding alongside Shampri and Benj all your questions. Of course, I can't go without thanking our amazing team who helped run all this stuff in the background. Ruth and Abby in particular have been amazing, along with Greg, who's been keeping me right through this Q&A. And the whole team that's helped put the work in for the protocol. And that includes not our team, but the teams out there that have been testing and iterating and bringing it to this point, and have enabled us to bring this to you, teams from across the health and social care system. My career, the majority of my career has been in the third sector, and I've really recognised the power and value and importance of that. And alongside our social work and social care colleagues, that this is a whole system answer, and how we can work with you to enable that to be manifested locally is what will drive us going forward. So really thank you for your engagement, as Rachel said today. Thank you for your time. Thank you for being part of it. Thank you for your criticisms and your critiques and your challenges. All of that is intensely welcome going forward. So I hope you now get some time to digest the detail of the protocol, and the next event we can have, and our interactions with you will be able to further iterate and improve that work. So thank you. That is now the end of the session, and I'm delighted that we now have a protocol for mental health substance use for all those people for whom are falling through the cracks currently. Thank you.